Good evening to everyone and welcome to today's session. Today, being a weekend, is a very packed day. But we felt without spending an evening with the students, is the evening worth living? So that way, teacher become addicted to the students and vice versa if also happens. For reading, reviewing, testing every day with at least 5 to 10 topics, then we will be able to finish all the 1250 topics and then go to the exam confidently. So what did we finish in ENT, doctor? We have finished anatomy, from which lot of questions come. Laryngeal cancer, nasopharyngeal cancer, nasopharyngeal angiofibroma, acoustic neuroma, Meniere's disease. Then we also have reviewed vocal cord paralysis and many more topics. Still there are a few more topics left. They will finish today. Ideally every Saturday we are supposed to have a subject test followed by, can you slightly decrease voice? Subject test followed by discussion. 2 to 5 subject tests, 5 to 8 we have discussion. But since this is still the first week, so on Monday you will have the subject test. For the online users, you will have an online subject test. And the students coming to Vizag and all our physical centers, you will be given a question paper, 2 to 5. 5 to 8, instead of 5 to 8, 4:30 to 7, we have Dr. Srinivas Murthy, the ENT surgeon, a very good teacher. So he will be reviewing the session on Monday and also on Tuesday. There are some more miscellaneous topics left over. We will have session on Tuesday. Even Tuesday session also we have in the evening 4:30 to 7. So that's the idea. So let us make this start. We welcome our online students, Dr. Sarvodaya, Vizag, Ahmedabad, and Jabalpur, Akshara, Tirupati, and many more students online. Now, doctor, paranasal sinus carcinomas is one of the favorite question of the examiner. Very few points you need to know. What is the most common histology of the squamous of the paranasal cancer? It is the squamous cell carcinoma. Typically, the patient presents with a swelling in the maxillary area. That is the normal side. This is the maxilla, which is having maxillary sinus, which is having the squamous cell carcinoma. Then, the peculiarity of the paranasal sinuses, unlike a nasopharyngeal carcinoma, is the nodal metastases are uncommon, unlike a laryngeal or a pharyngeal cancer. And only in the late stages you will find the nodal metastasis. And what is the best way to diagnose paranasal malignancies, doctor? CT scan, any day. Then how can you approach a maxillary sinus carcinoma? We do a Calvel-Lux procedure and we can be able to directly visualize the site of the tumor in the maxillary sinus. And the Calvel-Lux will be helping us to basically stage the cancer is what we need to basically remember. So we welcome Dr. Vikas and few more students who have joined. Now, Ongren's classification for the prognosis of the maxillary sinus carcinoma is one small point that we need to know. What is that? You draw an imaginary plane which is extending between the medial canthus of the ear towards the angle of mandible. Any growth, maxillary sinus carcinoma, which is situated above this plane is called suprastructural, and suprastructural tumors have got a poorer prognosis than the tumors which are below this line, which are fundamentally infrastructural, is what need to be remembered. Now, what is the treatment of maxillary sinus carcinoma? Since it is a squamous cell carcinoma, always a combination of radiotherapy and surgery. gives the best results, then either of them alone is what need to be remembered. How do you give radiotherapy in case of the maxillary cell sinus carcinoma? We give preoperative telecobalt therapy followed by 4 to 6 weeks. We do the surgical excision of the growth by doing a total or an extended maxillectomy, which is considered to be the management of choice, and surgery has a very important role. One of the favorite questions of the examiner. Treatment of maxillary sinus carcinoma. One of the MCQs we answered the other day. So, surgery plus radiotherapy combined is what we basically use. Now, ethmoid sinus malignancies. Few comments we require to place. Typically, the maxillary sinus carcinoma by extension will lead to the malignancy extended into ethmoid sinus. Otherwise, by itself, it does not give rise to. But one favorite MCQ of the examiner, in the woodworkers, it is the adenocarcinoma of the ethmoid sinus, which is very common. Similarly, nickel workers who use nickel, they also will have high incidence of the carcinoma of the ethmoid sinus. So how do you treat ethmoid sinus carcinoma? Once more, surgery. Typically in early cases we give preoperative radiation followed by lateral rhinotomy and total ethmoidectomy. But ethmoid sinus is related with the cribriform plate. And if at all the cribriform plate is involved, then we need to expose the anterior cranial fossa, and what we call is called craniofacial resection. Just to add to the completion. So in the notes given to you, wherever the points which are previously asked as MCQs, we have clearly mentioned in the parenthesis, so that we want to do what is called spoon feeding. We don't want you to take a lot of pressure in remembering so many things. Suppose if you read that point in isolation, difficult to remember, it will be very dry. But if you read it as a part of continuity of the topic, you will remember it forever. So that is the whole idea of giving you the notes.